reported today in The Verge. CDC flu pandemic plans hint at the playbook for a new coronavirus outbreak. The Centers for Disease Control and Prevention, CDC, is preparing for the possibility that the new coronavirus will spread through the United States, and it's using its guidelines for pandemic influenza as a starting point. The new coronavirus isn't influenza, so the recommendations probably won't match what may happen during a coronavirus outbreak. But they're a useful starting place for U.S. public health agencies. Because we have done a lot of planning around pandemic influenza, we have a good head start. But we need to look at the plans and see how the current situation might alter them, said Nancy Messonnier, director of the National Center for Immunization and Respiratory Diseases at the CDC, during a press call at the beginning of February. Exactly right. Would add that much of our pandemic planning is, rightly, predicated on influenza. That work still has value, but the underlying assumptions should be carefully evaluated to see what should be kept, modified, discarded. https://t.go/z9onctksgi. There are still only a few dozen people with the confirmed disease caused by the new coronavirus in the US, and the overwhelming majority of cases are people who had recently been in Wuhan, the outbreak's epicenter, or who were on the cruise ship the Diamond Princess. But there are over 80,000 people sick with the virus around the world, and new hotspots in South Korea, Italy, and Iran are making experts concerned that containing it may no longer be possible. Ultimately, we expect we will see community spread in this country, Messonnier said in a press conference on Tuesday. The CDC's pandemic influenza guidelines were updated in 2017 and now include lessons learned from the response to H1N1, or swine flu, in 2009. They outline the actions, outside of drugs and pharmaceuticals, that communities can take to reduce the spread and impact of a global outbreak of a new flu. Those fall into three categories: personal, community, and environmental. Personal interventions start with common sense steps taken for any illness. The guidelines say people should wash their hands, cough into their arm, and stay home if they're sick. During an active, severe outbreak that intensifies, in those cases, people who live in the same house as a sick person, who are at a high risk of contracting the illness, should also stay home from work or school to avoid spreading it to others. Public or community health actions recommended by the CDC are more extreme. The agency might encourage certain areas to close down schools and rely on tele-learning during severe epidemics. That might be done as a precautionary measure before a large portion of a student body gets sick or after administrators start to see illness in students and teachers. During the H1N1 outbreak, and for more on this story, visit the news article link.